I'm Dr. Michelle Taylor, Director of the Shelby County Health Department, and I'm here to give the COVID briefing for the Joint COVID Task Force today, and I'm going to show a few slides. Total COVID-19 cases reported today, 145,070. New cases reported today, 102. That is down from 122 this time last week and 294 2 weeks ago. It is interesting to note that for several days this week, from Sunday, October 17th to Tuesday, October 19th, less than 100 new cases were reported each day. The 7-day average of cases per day is 114. The 7-day average has also continued a downward trend, down from 143 this time last week and 237 2 weeks ago. We continue to see a downward trend in active cases in every age range, including pediatric cases. Today, we report 326 active pediatric cases, down from 558 last week and 823 2 weeks ago. Pediatric cases now comprise 24% of all active cases, down from 28.9% this time last week and 29.9% 2 weeks ago. This is significant and encouraging news because protecting vulnerable children is one of our highest priorities. Next slide. The 7-day average test positivity rate is now 6.8%, which is up from 5.8% this time last week and on par with 6.9% rate we reported 2 weeks ago. The lowest positivity rate we have seen during the pandemic is 2.3% back on June 21st, 2021. Next slide. The effective reproductive number, or RT, of the virus is now 0.73, down from 0.75 last week. RT has continued a downward trend that began in September and coincided with the mask mandate in indoor public spaces. The hospitalization data also shows the same downward trend we have seen in active cases. Today, 202 COVID-19 positive persons are in regional hospitals. That is down from 317 this time last week and 370 2 weeks ago. Next slide. This is a new slide that shows a comparison of what Shelby County looks like to some of the other counties and localities that are located near Shelby County. As you can see, the blue line at the very bottom of the graph shows that our case rates have remained lower than all of our contiguous counties and localities to date. Next slide. And if you were wondering how we compare to some of the other urban counties in the state, this is just one example. Knox County is shown in the orange line, and Shelby County is shown with the blue line. And even though Shelby County has had lower vaccination rates than Knox County, we continue to stay lower in our case rate when compared to Knox County. And we can see that if you look at the month, August, when we began the mask requirements in our schools and in our indoor public spaces, you can see that our decrease was much faster and we have remained lower in spite of having lower vaccination rates in Shelby County. Next slide. And this is a slide that you're familiar with. All of our active cases by age group continue to decrease across all age groupings. Next slide. As you see, the active cases continue to be concentrated in zip codes that have the lowest rates of vaccination, with zip code 38127 reporting the highest active case rate. Next slide. And this is a similar slide, but shows where the concentration of active pediatric cases by zip code are. Next slide. And this is a new slide today as well. It illustrates what percentage of vaccinations given each day that are first, second, and third doses. This is actually a chart, and what you can see is that the percentage of initiated, completed, and then additional doses. Please note that the completed and the additional dose percentages do not overlap. Right now, with the boosters in place, we have about 3.8% of our population in Shelby County that have already received additional doses. Next slide. This is a slide showing what I just showed you on the chart, which shows that there is a spike in third doses in late September, early October, and to date, the majority of the vaccine doses that we are seeing being given in the county are third doses. But, as you know, we would like to see a continued increase in the rate of first doses in order to reach our vaccination goal. This is the last of my slides for today.